Hi, everybody. What a great night. What a great crowd. So happy that everybody came out to celebrate and see each other. It's been a while. I'm Susan Fox. I'm the chair of the Westchester County Association Board and president and CEO of White Plains Hospital. It's my pleasure to welcome all of you to tonight's annual Toasting to a Healthy Westchester dinner. Apparently this is an annual dinner, but we haven't had it since 2019. And even though we know Mike Romita has only been with us a couple of years, I tested him and said, and is this really annual? And who did we honor? And he couldn't remember, so. Okay, they tell me it's annual, okay. These last few years have been unprecedented. And I thank my fellow healthcare leaders for their incredible efforts. What you and your staff did to protect and care for our community when Westchester was ground zero for COVID is truly remarkable. While COVID is not gone, we have learned to adapt and move forward. But that's just what we do in healthcare. We are always there facing new challenges, talent shortages, reimbursement issues, and of course, public health issues. But we are resilient, nimble, innovative, and always looking to provide the best care for our communities. And we are fortunate to have a partner in the WCA who has prioritized healthcare as a key focus area. Almost 20% of the WCA's membership is made up of healthcare leaders. And about half of tonight's audience are from the healthcare sector. The WCA works hard to bring us together in a number of ways to advocate and advance solutions that benefit our organizations and in turn make sure that Westchester remains a healthy, thriving, and vibrant county. If we are talking about healthcare in the WCA, we must take a moment and recognize Amy Allen. Amy is the WCA's lead for our efforts. Amy, thank you for your relentless championing of our initiatives and your tireless advocating for all of us at the state and local level. Thank you again. And of course, I would like to recognize and thank Mike Romita for his leadership these past few years. We have relied on the support and collaboration of the WCA to come back together stronger after the pandemic. Tonight, we will recognize our WCA Healthcare Champion honorees, ENT and Allergies Bob Glazer and former Burke CEO Jeff Menkes. Both Bob and Jeff have dedicated their careers to healthcare in our region and have played such an important role in WCA's healthcare initiatives. Unfortunately, Bob is unable to be with us tonight. He's sick. We won't say what he has. Okay. I've had the pleasure of working with Bob over the years, and the work he has done to create a multi-state network of ENT physicians is, needless to say, very impressive. And Jeff Menkes, I don't know him as well. Okay. I did not pick him, but for those of you who aren't in on the joke, Jeff is my husband. Okay. But seriously, I am very proud of Jeff and all that he has accomplished in his 50 years of healthcare. I am looking forward to a great night. Okay, thank you, Jeff. I'm looking forward to a great night and so thankful to Dr. Mary Bassett, our New York State Commissioner of Health, for joining us this evening. If my facts are correct, Dr. Bassett, you were appointed as Acting Commissioner of Health by Governor Hochul exactly 1 year ago today, September 29th, and officially took over the role a few months later. We look forward to hearing from you in just a few minutes. I would also like to thank our own Westchester County Commissioner of Health, Dr. Shirlita Amler, for being here tonight. She will be introducing Dr. Bassett. And just so we know, Dr. Amler was on speed dial to many of us in the room during COVID, and we really appreciate her leadership and always being accessible to all of us. So thank you, Charlita. Tonight's event is the main fundraiser that supports WCA's healthcare efforts. We are so very appreciative for all of you, healthcare or not, coming out tonight and supporting this event. It's now my pleasure to turn the program over to our president, Mike Ramita.
Well, thank you, Susan. And yes, I do what Susan and Amy tell me to do. So my job is much easier than theirs tonight. But the entire professional community owes you and your healthcare providers a huge debt of gratitude for all you've accomplished, particularly the last couple of years. We are the business partner of the Hudson Valley's healthcare sector. As Susan mentioned, we saw very early on how tied the regional economy is to healthcare and also its importance to community building. Access to world-class healthcare is one of the reasons why folks want to move to Westchester and why businesses want to come to Westchester and grow. Tonight's event supports our initiatives, our programs, research, stakeholder meetings, talent acquisition, legislative advocacy, all focused on making your organizations stronger. It's also an excuse to drink. I'm a Scotch drinker. I don't know much about wine, but tonight I can make an exception. So I hope we can all enjoy ourselves. And really, this is a toast to all of you. So thank you very much for coming in tonight. We have a lot of healthcare leaders in the room tonight from organizations such as the Montefiore family, New York Presbyterian, MSK, Northwell, Hospital for Special Surgery, WestMed, WMC Health, St. John's Riverside, United Hebrew, Open Door Medical, the Mount Vernon Neighborhood Health Center, and others. Also a special welcome to the New York Blood Center, the newest member of Westchester's healthcare community. We have some dignitaries in the room. Majority Leader Cousins was here earlier. Amy Paulin is here. Rumor has it that Amy knows quite a bit about healthcare. And from the county, Joan McDonald, Emily Salzman, and Dr. Amler, the leader of our county health department. To Dr. Bassett, thank you for joining us this evening. Did you know when you took your appointment you would become a television celebrity? I can tell you that your PSAs lower the blood pressure in my house, and when I see the commercials, I can almost convince myself that things are actually going to be okay. To tonight's honorees, Jeff Menkes and the aforementioned Bob Glazer. Bob, we miss you, although we're so glad that your daughter is here on your behalf to accept this award. Even though you are transitioning into different posts, you'll always be a part of the WCA family, and we will continue to call on you for knowledge and guidance, whether you like it or not. And I want to thank our sponsors. There are a lot of them, but they're worth mentioning by name, but I will get through them. Blakely, Platt & Schmidt, ENT and Allergy Associates, LOHUD, the Montefiore Einstein family, Northwell, Northern Westchester and Phelps Hospitals, New York Presbyterian, White Plains Hospital, Burke, C-Clean, the Greater New York Hospital Association, Harrison Edwards, Healthy Connections, KeyBank Healthcare, Martin, Clearwater and Bell, Open Door Family Medical, WMC Health, Copy and Art, HSS, and United Hebrew as well. Thank you. Now it's my pleasure to introduce to the podium really the beating heart of the WCA and the leader of our healthcare initiatives, Amy Allen.
Well, thanks, Michael, and Susan, thank you. It's kind of a lot to live up to, so I'll try and explain why this is what we do. But first, I want to say how great it is to be here with everyone back in person. It's very hard to have a wine dinner virtually, so I'm glad we were able to do this, and it's definitely my favorite WCA event. And as you've heard, we at the WCA, we're very passionate, and I am in particular, about supporting our healthcare ecosystem. And we promised to continue to work tirelessly to ensure that our legislators and business leaders understand the far-reaching implications of key healthcare policy issues. Our healthcare advocacy priorities, they're developed through the work of our healthcare consortium, comprised of healthcare and advisory leaders. And the consortium's co-chairs are currently Derek Anderson, head of Northern Westchester Hospital, part of the Northwell system, and Bill Harrington, partner at the law firm Bleakley and Platt. Unfortunately, I'm not sure if either of them are here, but I know their organizations are represented well by tables. And for those of you who don't know, Bill Harrington used to be, before Susan, the chair of the WCA, and he and our former CEO, Bill Mooney, who's out there somewhere, they were the genesis for our WCA healthcare efforts. We also work with statewide and regional associations such as Haney's, Suburban Hospital Alliance, Greater New York Hospital Association, Iroquois Healthcare Association to give our voice statewide impact. And our legislative and regulatory priorities, they include, as I believe Michael mentioned, ensuring adequate government funding levels, requiring appropriate reimbursement from public and private payers, reining in excessive market influence of health insurance companies, Bill Mooney's favorite topic, and allowing for greater workforce flexibility. And we've had some successes. For example, federal funds appropriated through the CARES Act and ARPA totaled $801 million for Westchester County providers, of which $466 million went to hospitals. In addition, this year's New York State budget included some additional Medicaid reimbursement for the first time in over a decade, with hopefully more to come. We were also successful in helping to secure the passage of telehealth payment parity. Of course, telehealth utilization skyrocketed during the pandemic, and it continues to help improve access to many patients. Investment in healthcare workforce and scope of practice flexibility are significant hallmarks of our advocacy agenda. Workforce shortages, exacerbated by the COVID-19 pandemic, are at the top of the priority list when we speak with healthcare providers. And key reforms that we are advocating for include streamlining licensure and registration processes, expanding scope of practice in certain areas, and allowing simulation training to be included as a portion of clinical hours. Many of these measures are consistent with neighboring states, and New York must continue to attract the best and brightest talent. We're also helping to solve workforce needs through our grant initiatives, such as the county-funded Talent Pipeline, Healthcare Talent Pipeline Program. Thank you, Joan and Deborah and company. We have, to date, this program has trained 50 potential healthcare workers, with another 75 signed up for future training. And area healthcare providers have already hired close to 20 program graduates. And this results in millions of dollars of economic impact every time somebody is hired. And we also save our healthcare employers time and money by bringing pre-qualified talent directly to you. And I certainly want to acknowledge our Director of Workforce Development, Jason Chapin, who manages our grant programs and works tirelessly to help fill your talent needs. Jason, where are you? Back. On the programmatic front, the WCA's proprietary All Access Healthcare series brings timely and relevant content from subject matter experts. Recent topics have included trend reports, robotics and AI, and the latest COVID-19 information. We provided these programs virtually throughout the pandemic, and fortunately, our most recent program was back in person. Hopefully, we can continue that. We welcome input from all of you about advocacy or program initiatives that deserve our focus and attention, because our success is ultimately measured by how well we help you succeed. Okay, now on to the celebratory part of the evening. They are celebrities. Michael, I'm going to ask you to come join me as we present our 2022 WCA Healthcare Champion Awards. And the first award will go to Bob Glazier, who, as you heard, unfortunately could not be here. But under Bob's leadership for the past 25 years, ENT and Allergy Associates has grown from an organization of 12 partners and 8 locations to over 300 clinicians practicing in over 56 office locations throughout New York and New Jersey. In addition, Bob was one of the first members of the WCA healthcare community to engage with and educate the WCA about the complexities of the healthcare industry. For well over a decade, Bob has always brought to the forefront the issues that have become the hallmark of our advocacy work, and he has served as a longtime WCA board member. Accepting the award on Bob's behalf is his daughter, Emma. Emma is... Yep. Put you in the middle.
Thank you very much.
Put you in the middle.
Okay.
Yeah, go ahead.
Hi, everyone. I'm Emma Glazer, Bob's daughter. Thank you all for being here tonight. And as was mentioned, unfortunately, my dad couldn't be here this evening and asked me to stand here in his place. He's fine, don't worry. I'm very grateful and appreciative to the WCA for selecting my dad this evening as one of this year's Healthcare Champion Award recipients. I'm honored and humbled to accept this award on his behalf, and I know he would want me to express how excited he is to join the ranks of so many past honorees. My dad, of course, would also want me to congratulate Jeff Menkes for his incredible contributions as well. So thank you, Jeff. And lastly, of course, my dad would, I'm sure, thank his family. So I will thank myself up here. So as Amy mentioned, under my dad's leadership over the last decade and change, ENT and Allergy Associates has grown to become the largest ear, nose, and throat practice in the country. It has more than 240 board-certified specialists and 1,200 staff members in its 56 offices throughout New York and New Jersey. Today, the practice serves more than 120,000 patients each month and is on track to serve about 1.6 million patients this year. Its mission is to deliver the best medical care to each and every patient with compassion, dedication, and respect. I know the group prides itself on top-tier talent, cutting-edge technology, accessibility, and a strong company culture. My dad would, of course, always credit his team members for ENT's continued growth and success. Many of these colleagues still work with him today and are people I've known for the last 20 years. Lastly, thank you again from the bottom of our hearts. I'm really proud to accept this award on my dad's behalf.
There's one other thing for him too, some citations from you. What? Another photo? Okay, another photo.
Michael.
With the citations?
Ah, sorry.
No, excuse me.
All right, we got everything, we gotta see it though.
Oh, we have to open it.
Open them.
Okay.
Just one, I guess, right?
There we go.
Okay.
Okay. Whew. Okay, we gotta do that one more, we have to do that one more time. Here you go. Here's your. Okay. Our next award goes to our good friend, Jeff Menkes. Jeff has been a leader in the New York metropolitan healthcare landscape for his entire professional career. He became the youngest hospital CEO in New York City history, leading Elmhurst Hospital Center in Queens at age 31. His vast experience has included leadership in some of the most prestigious hospital and healthcare systems in the New York metropolitan area, including the Montefiore Health System for the last 10 years. Jeff has recently retired from the CEO role at Burke, which he led for the past 5 years. Jeff has been a valued member of the WCA Executive Committee and a leader in our healthcare initiatives. Please join us in congratulating Jeff Menkes. Okay, wait, picture, here we go. Picture, you in the middle. Citation, we got this right now.
Okay, thank you. Thank you. So, you know, I allegedly retired the end of June. But the fact is, I haven't worn a suit since that day. And I have no less than 10 separate texts from my wife. Did you get your suit cleaned? Do you have a clean shirt? Did you polish your shoes? And I guess I did. Here I am. And certainly I want to convey congratulations to Bob Glazer. I know Bob a lifetime, and he has had equal success to anything that I've done in my career. So congratulations there. So Amy, thank you very much for the introduction. Being honored is something that I've just never gotten used to. I'm just so much more comfortable being the person who stands up and wishes friends, colleagues, and honored guests the best for their promotion, their new job, a successful joint commission, White Plains in the middle of it right now, a ribbon cutting for a major capital project, thanking a donor for their contributions, or an elected official for their public support of an initiative or a change in policy. As you heard, my career has spanned 50 years. It's hard to believe, but it's true. And I've had the unique privilege to directly be a part of the evolution of delivery of healthcare services in the New York metropolitan area. As you heard, my career started at Elmhurst Hospital, part of the Health and Hospital Corporation, a then 965-bed teaching hospital affiliate of the Mount Sinai School of Medicine, located in Queens, the borough where I grew up. I started as a resident and then rose to become, it's true, the youngest CEO of a teaching hospital in New York City at the tender age of 31. Hard to believe when you think back on that. Over the course of my career, I went on to leadership positions at very prestigious healthcare systems and hospitals, including Columbia Presbyterian Medical Center, Long Island Jewish Medical Center, the Mount Sinai Medical Center, and most recently with the Montefiore Health System, where I was one of the key people who were responsible for Montefiore's expansion into Westchester County and the Hudson Valley. It was as a member of the senior leadership team at Montefiore and in 2013 that I was introduced to Bill Mooney and to the Westchester County Association. Bill and I, is Bill my good buddy, Bill and I just clicked in our mutual understanding that a health system like Montefiore expanding into Westchester was good for the economy of Westchester County by preserving and adding jobs. But this is where Bill really came in, and Bill and I really collaborated. But it would also be a significant benefit to the residents and business owners in the county to not have their employees out-migrate to Manhattan and neighboring states like New Jersey and Connecticut at significantly higher premium costs. Today, while Montefiore has the largest healthcare presence in Westchester, New York Presbyterian, Northwell Health, the Hospital for Special Surgery, Memorial Sloan Kettering, in addition to the already present Westchester Medical Center, plus the tremendous growth of White Plains Hospital as a true tertiary hub, have all contributed to the stability and growth of healthcare in the county, which now exceeds billions, not just one or two, but more than several billions of dollars. All these institutions are members of the WCA, and as was stated, many of those leaders are here tonight. The Westchester County Association successfully brings together the leadership of not only healthcare, but industry leaders in education, real estate, IT, biomedical technology, energy, and banking, to name a few, to focus on the continued economic growth and job opportunities for our county. I want to personally mention to you, because I really did, as a board member, develop a passion, and that passion, Amy kind of touched on that, was really looking at creating entry-level job opportunities in healthcare, especially in nursing, where the demand for new nursing personnel far exceeded the supply. As we learned, job opportunities as trainees or entry-level positions were often hindered by the fact that public transportation for bus and train routes in the county did not make it easy for trainees and first-time job seekers to get to a place of employment. So many potential entry-level position, new employees who do not have a car, because not everybody can afford a car, must rely on public transportation, which is not convenient for getting to work locations on time in our county. And I just want to relate to you a little story from Burke, because Burke is, located on Mamaroneck Avenue in that really beautiful campus, 61 acres. And the number 60 bus comes down Mamaroneck Avenue and stops on Mamaroneck Avenue, but then any employees coming to work or potential employees have to walk up to a half a mile, believe it or not, to get to the front door of the hospital. We reached out through WCA to many of our elected officials here in the room. We had total support. We first had to find out really who owned Mamaroneck Avenue, and it turns out that George Latimer does. Right, Joan? And believe it or not, he is still supportive of improving the transportation, because at Burke, just to complete the story, we offered to create a new roadway and have the number 60 bus come onto the campus so that existing employees and new potential employees could be dropped right at the front door of the hospital. I was informed that it would add 3 minutes to the route of the number 60 bus, but I say, so what? Look what it would do to attracting new people for jobs who didn't have a car. So I am hopeful that Scott Edelman, who is my replacement at Burke, will continue to work with WCA and particularly with our county elected officials to try and make this happen. But you could also extend that to many other situations in our healthcare institutions. Even if you take the Metro North station in White Plains, we could easily try and find a grant where a bus or transportation form of a van would stop at both White Plains Hospital and Burke over on a schedule. It's a good thing to pick up on, because the nursing shortage in our county is significant. And I will tell you, when I left Burke, on any day, we had between 25 and 30 open positions for entry-level nursing personnel. And on top of that, Amy, you know all about creating career paths for people in nursing. So that's my little story about Burke, where the work needs to continue. And just continue my short story, I was on the board for WCA for 9 years. And in that time, I had the privilege to lead the WCA search committee, which brought us Michael Romita as WCA's new president after Bill Mooney decided to retire. We had in Bill, and now have in Michael, a passionate leader advocating for making a stronger Westchester. The board and membership of the WCA are to be congratulated. This organization does an outstanding job in supporting WCA's core mission for continued economic growth through favorable public policy changes and grant opportunities. And each of you here today should feel very, very positive about your continued contributions. So I appreciate very much the recognition, and I thank you very much. Thank you.
Thanks. Jeff, you didn't retire. You have a new career as a transportation consultant. I see that in your future. Oh, you want to drive the bus? Okay. Again, congratulations to Bob and to Jeff. We are now going to take a short break while dinner is served, and we'll be back to you very shortly with our much anticipated keynote speaker. So bon appetit, everyone.
Good evening. I'm Dr. Shirley Damler, Commissioner of Health for Westchester County, and it is my genuine pleasure to introduce New York State's 17th Commissioner of Health, Mary T. Bassett, MD, MPH. Dr. Bassett brings more than 30 years of experience in public health and a dedication to diversity and equality worldwide. As our state health commissioner, she has established a meaningful professional relationship with local public health department commissioners and directors, which has been vital and refreshing. As we have worked as a team navigating through the changing landscape of COVID, monkeypox, and polio, and perhaps new challenges yet unknown. Originally from New York City and formerly New York City's health commissioner, Dr. Bassett lived in Zimbabwe for 20 years, where she joined the medical faculty at the University of Zimbabwe and was Associate Director for Health Equity at the Rockefeller Foundation's Southern African Office. She was also the Program Director of the African Health Initiative and the Child Well-Being Program at the Doris Duke Charitable Foundation. Before her current appointment as our state health commissioner, she was director of Harvard's FXB Center for Health and Human Rights. Dr. Bassett was educated at Harvard University and Columbia University's College of Physicians and Surgeons, with a medical residency at Harlem Hospital Center and a master's degree in public health from the University of Washington, where she was a Robert Wood Johnson's clinical scholar. She is an elected member of the National Academy of Science and a recipient of the prestigious Frank A. Calderon Prize at Columbia's Mailman School of Public Health. A colleague of Dr. Bassett describes her as a blazing trail to promote diversity, health equity, and access to quality health to the forefront of healthcare landscape across the state. I would say that's absolutely true. So please join me in welcoming Dr. Mary Bassett. And Dr. Bassett has graciously agreed to doing a Q&A when she finishes her remarks. So thank you, Dr. Bassett.
Thank you, and good evening, everyone. I have prepared remarks here, but and I'm sure I'll have a lot of people I thank in those remarks. First, I want to point out that I'm wearing a mask, so I'm trying out what it feels like to be the only person in a crowd wearing a mask. And I have to tell you, it's not very easy. So I just feel, as your health commissioner and a pandemic that people feel is waning, some feel is over, that we are going into fall and winter. And we know that the rates of infection, hospitalizations, and yes, deaths will increase in these winter months. So we have given up many, many protections because we all collectively agreed that we're safe enough. But the reason that we're safe enough is because of vaccination. And I just want to make a plea that everybody talk to everyone they know. We need you to get that booster. The bivalent booster is the first time we've had a vaccination that is geared to the circulating strain. I looked at the numbers. We lost something like 70% of the people we have lost in this pandemic were people over the age of 65. But only 25% have gotten all the primary course and just 2 boosters. And now there's a 3rd booster available. If you haven't gotten a shot for COVID since July, you're eligible. Go out and get your booster and tell everybody to get it. So that was my spiel. I'm not doing another ad, Mike. And I also just want to thank Shirlita Amlin, the County Health Commissioner, for her kind words and kind introduction. This is the first time that we have met in person, and I have something else to thank her for. She offered to swap seats with me this evening so that I got to see the sunset over the Hudson River. And I live in Albany now. I'm a New York City born, not born, but raised. And in Albany, they have a wonderful museum which has some 100 Hudson River Valley paintings. If you haven't ever been there, I recommend you go. But there's just nothing like the real thing. So we're in a really beautiful place, and we have Mike Romita to thank for plentiful lubrication for the evening. So this is my first official visit to Westchester as a health commissioner. And I also want to give a shout out to the awardees. I was just saying to Jeff Manx that I'm a Health and Hospitals Corporation product. I trained at the public hospital system of New York. He is proof that that system knew how to spot talent early, and because he became the head of the Elmhurst, also a proud public hospital. And in talking about what makes people healthy, thinking about the fact that people need transportation to get to their jobs, I think reflects the long shadow that having worked in a public hospital has endowed all of us with an understanding of what the challenges of deprivation to health. So thank you, Jeff, for those really remarkable words this evening. And I want to thank the person who was here for the other awardee for those really charming remarks. I can't see you here. You're here. There you are. So I am here for the first time, and I'm really glad to be here. I also know, as all of you know from direct experience, many of you from my chats before and during dinner, that this was ground zero for the statewide COVID outbreak in early 2020. And Westchester really rose to this challenge. All of Westchester rose to this challenge. Public health officials, healthcare providers, and there were many decisive measures taken that set the stage for the statewide response. That included the first drive-through testing site in the state that was done in conjunction with the National Guard. There were field visits and testing in facilities like nursing homes and assisted living, where we know our residents continue to be particularly vulnerable. And there was the information hotline that was set up, which meant that people could be connected to other supports or wraparound services. So you have the distinction, perhaps because you bore the burden early of the COVID pandemic, of having a primary course vaccination coverage rate of 83% of the population. That's high. The national figure is about 2/3, just so you know. I mean, we still have a third of our population in this country that has not been fully vaccinated with just the primary course, let alone boosters. So, we all know, and I'm saying something that all of you witnessed and many others have said, that COVID really pulled back the curtain on all of the ways in which our society has failed to deliver the opportunity for good health to all the people who live here. And I'm talking about the real disparities that we're seeing in COVID infection, illness, and death by racial, ethnic, and socioeconomic lines. So in many ways, COVID really carved a brutal path through our communities, and a work that I did with colleagues at the Harvard School of Public Health, where I was before I took this job, showed really in very stark terms the way in which the disproportionate burden fell upon communities of color. These were communities where many people worked in essential jobs. They had to keep working in order to keep getting a salary. I mean, you could stop working, but if you had to keep working to pay the rent and feed your family. You commuted to work, often in crowded public transportation. You worked, in public-facing jobs and returned home to crowded, multi-generational households. And on a national level, this meant that in young age groups, the risk of death from COVID among Black and Latinos ranged from 5 to 9-fold higher than their equivalent age white counterparts. So most of the people who succumbed to COVID were older individuals, but there was a disproportionate share of younger individuals of color. And this was not because of reckless behavior. Let's be clear about that. This was because the risk of exposure was so much higher, and so many people already suffered chronic diseases that made their outcomes riskier. So Westchester really stepped forward on vaccine equity. It has administered more than 70,000 COVID vaccines to at-risk populations, and through its mass vaccination sites, through pop-up sites, to school vaccination sites. And so, this is how we have to address inequities, by making it much easier for people to get the services that we need them to receive. So, for example, services were brought directly to homebound residents. I really didn't need this pandemic to eliminate. I didn't need it. None of us needed it. But I didn't need it to see the disparities in health that have so plagued our country. Even here in Westchester, which everyone thinks of as an extremely affluent county in our state. But even here, there are people who face real economic challenges and tough choices. They have to choose between buying their medicines or buying groceries. There are people who struggle to pay the rent and can't afford to take sick leave that is unpaid. So Westchester may not be the place where we think these things happen, but we know that it is. While over half of the households earn over $100,000 a year, which, I mean, it's stunning to say, but even that doesn't seem that high anymore, does it? But over half of your households earn over $100,000 a year, and about 8%, though, earn under $15,000. So, obviously, that is doesn't even approach a living wage. So Westchester also has racial health disparities, including premature mortality, that's deaths before the age of 65. For African American residents in Westchester County, this proportion is 20% higher than it is for whites, and for Latinos, it's a little bit higher than that, 23%. And I'll just reiterate again that these reflect structural inadequacies of our society. We have for too long attributed to people's poor health, bad luck, or bad choices. But we have to acknowledge that the opportunity for good health is not equally distributed. The fact that a Black woman faces statewide 4 to 5-fold higher likelihood of dying during childbirth is not because of her choices alone. It's because of systemic racism and the impact of that on the woman, on the baby, and on the kind of health care that she may receive. So healthy living is not always a choice, especially for people who live in communities and neighborhoods where the infrastructure is really quite literally crumbling. I always feel, when I talk about how African American communities struggle with so much, I always feel that I have to make clear that we also need to acknowledge the assets these communities bring to all of us in the United States. So Mount Vernon is a largely African American community. Its population, African American population, is 65%. And it also faces real infrastructure problems. I'm told that on a regular basis, the ancient plumbing of Mount Vernon led to toxic sewage backups, and residents had, overflows of sewage whenever it rained. So, there are ways to tackle these things, and I'm proud to work for an administration that allocates funding where it needs to go. Governor Hochul released $150 million in state funding to address this longstanding inadequacies in the city's water infrastructure. And there's been a partnership between the state, the city of Mount Vernon, and Westchester County to work together to address this. These things cost millions and millions of dollars, and the dollars have been directed to the Third Street Sewer Project. There's also an $8 million assistance package for emergency repairs and a $3 million package for housing remediation. So this is a kind of structural problem that we have to see, and the kind of resources that need to be allocated to address them. And I have been, as you've heard, in all of my working life, determined to prioritize the right that every individual has to the highest attainable health that they can achieve. Not all of us will have the good fortune of long and healthy lives. Bad things do happen. But when we see these inequalities distributed unequally by population groups, these are unfair and correctable disparities. So in the midst of responding to COVID and then polio and then monkeypox, we also have done some reorganization at the health department. We have established a new office that reports to me that's titled the Office of Health Equity and Human Rights. And this really is intended to elevate the adoption of an equity lens to all of the work of the health department. We've also launched an Office of Aging and Long-Term Care, and I'll say a little bit more about that. But I thought I would say first something about overdose prevention. I realized when I was taking out of my business cards to hand somebody that I pulled out my naloxone kit to fetch my. So I carry naloxone, and I only have one. I should probably have two, actually, because fentanyl is hard to reverse. But you all know that during the COVID pandemic, we've seen overdose rates break records and continue to go up. And increasingly, this is not fueled by the epidemic that opened the door to opioids, prescription painkillers, but by street drugs that contain fentanyl. Increasingly, fentanyl is driving our overdose rate. Fentanyl in everything, not just in drugs that people who are looking for an opioid high it's in everything. It's in cocaine, it's in Molly, it's everywhere. These increasingly dangerous street drugs are driving the overdose epidemic. And too often, we have so stigmatized people who use drugs that it's very difficult for them and their family to get the services that they need. So I, join many at this point in seeing problem drug use as a chronic illness, not as something that we should see as a source of shame, but as something we should see as a need for treatment. Just as people who have diabetes may have, episodes when their blood sugar goes out of control. We don't say, actually, you've used up your opportunities to get treatment for your diabetes. We would never withhold treatment from people with diabetes. So in my view, it's really unthinkable to punish people struggling with opioid addiction, to tell them that they've relapsed too many times, and we need to make it possible for people to return to treatment as many times as they need it. So this really falls within the notion of harm reduction, which in my opinion is equivalent to recovery. Anyone who's getting safer is on the pathway to recover. That means anyone who's using a syringe exchange program, they're on the pathway to recovery. So we need to keep people alive so that they can become drug-free. And I'm very thankful that the tide is changing on this. The governor has outlined her plans to expand medications for opioid use disorder and harm reduction services. And I really want to thank and acknowledge the Westchester County for the, I'm not going to pronounce this right, Naloxbox program, is that right? Okay, which expands public access to naloxone. We're talking about things like vending machines where people can get naloxone or even syringes. So Westchester County is pioneering public access to naloxone with the Naloxbox program, and they have installed metal wall units containing naloxone in homeless shelters and conducted training in how to use nasal spray. So this is an example of how we get multiple partners to work together. The county health departments, local officials, community health services, all working together. The Westchester County Opioid Response and Overdose Prevention Initiative to address problems that are too large for anyone to address alone. You know, this is a really healthcare delivery, personal healthcare heavy crowd. So I expect that we'll get to some of that in the question and answer period. But let me just say a few words about this new Office of Aging and Long-Term Care. I wanted to establish this office in part in recognition of the price we paid during COVID for people who need long-term care. And I'm talking about mostly older people, but also there are many other people who have disabilities or for other reasons need long-term care. And so that's the mission of this office, to work across policy, programs, services, to really focus on the idea that we want everyone to be able to have healthy elder years in our state. And this is true for people who are seeking to age in place, as well as people who will seek care in nursing facilities. We have the fourth largest population of residents over the age of 65 in the country. That sounds like a lot, but we have the fourth largest population in the country. But we are, as a nation, facing a tidal wave of aging. We know that people who are elderly face things like falls that can land them in hospitals. The rates of hospitalizations due to falls in Westchester is rising. And by 2030, we think that a quarter of the state's population will be over 60. So aging baby boomers will be seeking care, and some of them will be seeking care in nursing homes and adult care facilities. So I've already made the pitch for COVID shots. I also have to make a pitch for flu shots. We had 2 seasons with no flu. And now last year it went up, it came down. Frankly, it went up and came down with masks. So we are seeing rising rates of flu already this season. It's going up quickly. It's really wonderful to have COVID restrictions relaxing. It means I get to go places again. And I was in Binghamton earlier this week. I was in Buffalo. I went to the State Fair in Syracuse. I visited in Binghamton a simulation, a nursing school that really focuses on simulation training. Beautiful new institution at SUNY Binghamton. I participated in a panel on health disparities in Harlem. And this evening, I have the good fortune of being here with all of you. I'd like to join you all in toasting a healthy Westchester, and I'll be happy to try to answer any of your questions. I don't know who will be should I just call on people or somebody will help me with this? One day the governor walked out and left me at a press conference. And the questions kept coming. I finally said, will somebody help me here? So let's, yes.
Hello, wonderful to meet
Good
you
evening.
here. I have a question about fentanyl. I
Sure.
spent the weekend hearing some horrible stories about some young people out on Long Island who had recently died. And the question I received from non-lawyers, non-healthcare people were twofold. One was, why aren't we seeing more public service ads about fentanyl? And why aren't we being very clear with the public about the fact that even marijuana is laced?
Yeah.
And then the second question I got was, is fentanyl a drug, and is it criminally prosecuted for possession? And are we bringing any actions at the state level against people who are possessing fentanyl other than in a hospital setting?
Okay, the idea of more public service announcements, I can't disagree with you on that. I want to say that the fentanyl that is ending up in our street drugs is not diverted from legal fentanyl that's used in hospitals. This is fentanyl coming, most of it is produced in China. It's imported illegally. It is a really potent drug. It's not like big blocks of heroin. It's in tiny amounts. You can bring it in. It's imported illegally. It used to be possible to get it on the internet, and it's been, it's, as you say, all over our drugs. I don't quite understand the reason, because we think it's being mixed high in the drug chain, because there's no reason for the dealer to kill their clients, right? So we think it's being mixed into the street drug supply, high in the supply train. I personally don't think that there's much point in criminally prosecuting people who have personal use amounts of any drug. Probably that will get me into trouble. But, I think that we really need to increase public awareness of how dangerous street drugs are. What people need to know is you should never use any drug alone. You should always have naloxone, and that if you should try a test dose before you go in for a whole drug use session. Now, when I gave that advice as a city health commissioner, I was called on the carpet, so because it sounded like I'm encouraging people. I'm not encouraging people, but people use drugs and are, arresting our way out of drug use was an astonishingly failed project. It filled our jails. It didn't solve the problem of drug use. Yeah.
Thank you. I wasn't sure if I was allowed. First, I want to thank you for your leadership, and we're so proud that you're the health commissioner for New York State. I can say that we in the legislature are so excited and gratified, at the same time. Excited that you're going to bring a vision, and gratified that you are the stalwart that we need in the health department. I wonder, I'm sure, and I was very happy to hear about the new department in aging and long-term care.
Right.
And you probably saw the article editorial in the Times Union today about home care. I who experienced firsthand having my mother with me in her last 4 years and taking such good care at White Plains Hospital, I'm very aware of the need for an increased or a better home care system.
Yes.
And I just wonder, what role the new department is going to play in that regard, and what your views are in terms of improving that system. We did try to increase the wages, but clearly not enough. And I just wondered, what the plan is for the future.
Well, one of the things that we're hopeful that we'll be able to sort of have a broader announcement about soon is a master plan on aging. because we really do need a cohesive plan. I mean, we need a more cohesive plan for our whole healthcare delivery system, to be honest. But that's one of the things. We have several different agencies that are important to this effort, including the State Office on Aging. You know, I'm really happy with the person who agreed to take on the helm of setting up this new office, Adam Herbst. I know that it's a real priority for him to try. We're going to work hard to make sure that we can do better at helping people to age with home care services and as an alternative to nursing home placement. But I can't give you an exact plan now. I know we're all working. My inbox is flooded with advocacy campaign about the $2 an hour that everyone expected to get. And I'm hopeful that we're getting somewhere with the plans and ensuring that people get the wages that they need and deserve. Some plans have reached agreements, as I understand it.
Good evening, Dr. Bassett. It's Cheryl Brannon over here.
Hi,
Great,
good evening.
delighted to see you again. I'm founder of Sister to Sister International, and we had the great pleasure earlier this year to have you visit us via a webinar, certainly going back into the April timeframe. So delighted to see you here this evening. I'm also very happy to hear you mention Black maternal health, because clearly that's an issue for us as well. As a matter of fact, we are in the process of creating a Westchester Black Maternal and Child Center of Excellence. And the crowd can actually roar on that one. And not only are we creating it, we're doing it using collective impact. We're partnering with Westchester County government. We're partnering with St. John's Riverside Hospital, Lower Hudson Valley Perinatal Network, Birth from the Earth. So we have a cross-sector of groups that are working together to improve birth outcomes for Black women here in Westchester County. So I just wanted to make that statement publicly, invite others to join us, and also to ask you if you'd be so kind, because you certainly have been a champion, if you might just take a moment to talk about some of the things that you're doing on the state level. You just mentioned this new commission that you put in place, et cetera. I'm sure all of that will be impactful. So thank you again.
Sure, thanks. So the health department has put out a report on maternal mortality. It was delayed, but it's out now, and that's the source of the fact that I gave, that there's a 4-fold higher risk of death related to pregnancy among Black women. And we're doing a lot of different things. One of the things that I'm really interested in is seeing whether we can resurrect our effort at a doula program and figure out how to support that. I do need to point out that the health department really was completely, called to service during the pandemic. So it meant that many people who had many other jobs were focusing on mass vac sites, on many things. So we're just getting started here. I just had a conversation with somebody in the executive about our interest in maternal mortality, and we're looking forward to it. You know that these aren't really directly related, but after the loss of Roe, you know that the governor allocated $35 million to supporting women who to ensure that this remains a state where women can make the decisions that they want. And having a wanted pregnancy, that's distinct from intended, but having a wanted pregnancy is also important to having a safe and healthy delivery. So we're putting money into these activities, but we don't have a specific initiative right now on Black maternal mortality. It's in planning. In the back there, all right, in the red. Oh, yes.
Yes, hi, Dr. Bassett. My name is Evie Valentine from FirstNet, built by AT&T. And I just wanted to say, I heard you speaking earlier about fentanyl and the drugs out there with our youths and young adults as well. And me as a parent out in Orange County, coming from the Bronx, it's a different world for me. But I just want to say thank you for bringing out the education, the awareness for us as parents, to know what's out there in the high schools, in the middle schools. And if you could continue putting out that education and what to look for in our children and what communities to get together with and, educate our children and make them stronger and confident that they don't have to go down that path or go with that friend or, just stand on their own 2 feet. Just continue to help us parents.
I really think the overarching message has to be that street drugs have never been more dangerous. And you just don't know what you'll be getting. No. I really feel like people should get to their desserts. Are you sure? Okay. All right.
Yes, Dr. Bassett.
Yes.
Getting back to your question, your statement about Roe and its impact on New York, the decision. Maybe you could talk about what it has meant to New York as a kind of a sanctuary state for people from around the country, and also if you have any thoughts about the proposed national ban on abortion that's being raised in Congress.
Right. Yes. You're a local reporter. Oh, very good. On the record here. This state regardless of the political power party that held the governorship, has been a pro-choice state. We had made abortion safe and legal before Roe. So we've been concerned that more people will seek abortions here in New York State, and that's happening somewhat. Especially in the areas bordering Pennsylvania, which has more restrictions. And the governor's $35 million, $25 million went to expand services, bolstering the number of abortion providers through existing contracts where people already provided abortion services. So we used that to increase the funding to ensure that we would have adequate services available. And now an RFA is going out for the additional $15 million. So the first $10 million went out immediately, or as quick as immediate is in state language, and another $15 million and will be bidded out. So it's expanding the availability of services. Other things that have been talked about by the legislature are helping people with funds for travel, so that people who need money to travel from out of state, but that was not a part of the governor's initial package. All right, thank you all.
Thank you, Dr. Bassett. The last time a physician spoke to me about lubrication, I was informed soon thereafter that my prostate is age appropriate. So, thank you for that. But I'm not going to close the program with that. It's a little upcoming. I forgot to mention that all of the wine was provided tonight by E.J. Gallo and Company, and it's not the boxed stuff, it's the good stuff, so thank you to them. Is Anthony Viceroy still in the room, or is he snuck out? So Anthony's one of our honorees at our annual leadership dinner coming up on November 17th. I hope to see all of you there to support us then as well. I just want to end by thanking our staff. If the staff can please raise your hands. Thank you so much for doing everything that you do for us. Thank you to the honorees. To hear about the passion, Jeff, that you still have for the WCA, I have to ask, are you coming for my job? And lastly, again, to come back to Amy Allen, who is the beating heart of the organization. Amy, please come up. We have a bouquet for you tonight, just to end the evening. And thanks to all of you. Please enjoy your dessert and coffee. hang around and drink some more, and hope we get to talk soon. Bye-bye.
Thank you again, and please feel free to take the bouquet that is in the table if you want it home. Thank you very much.